Morning, V.
Morning, Jackie. How are you?
Very well. How are you?
I'm great, thank you.
Welcome to another edition of our podcast for Greenbridge Community Housing. It's a really relaxed, really chilled conversation. Thanks for joining us today. If you want to introduce yourself and tell us where you are from and what you do.
So my name is V Rourke and I'm from Total Wellbeing Luton. I'm the Senior Employment Advisor within the service. So my main role is to advise people that are accessing the service, whether it's through mental health or their physical activities that they do with us, to advise them on any employment issues. So it could be somebody that's looking for work, but it also could be somebody who, you know, is a CEO of a company who's actually finding it hard going and they're dealing with stress and anxiety of the workplace.
Oh, right.
We have many users that for all different reasons come to us. And we help, as it says, we are an employment advisory service. So it could be that they're dealing with disciplinaries, they're, you know, just looking for alternative work, finding the workplace that they're not being fulfilled. So, and a lot of that has an impact on their mental health whilst they're going through all these different changes in their life.
What sort of impacts do you see it having on their mental health and well-being when they're looking to... So can anyone come to you? So if I'm employed in a company and I'm not happy and I want to change, I can just refer myself to come and talk to you, or do I have to go through channels? How does it work, first of all, V?
So yes, you can self-refer.
Right.
You can self-refer into our organisation by going online. We will ask you to have a assessment, which is carried out by a therapist, and that's just to gauge where you are in your life. Of, you know, do you also need at that stage a little bit of emotional support whilst you're going through this change? It may be that you're exasperating, you know, I've got to leave this job isn't for me, but actually when we break it down, there's a lot of other things that are overwhelming you and filling up your stress bucket.
Yeah.
So it may be that, you know, you've got a problem with your housing, you've got a problem with paying the bills, you've got all these different emotional things that are going on. So it's actually assessing what you actually need as well as the employment support.
Okay.
And what happens is, whilst my team work on advising you with your employment issues, it may be that you also work with a therapist at the same time to be able to give you tools and techniques to be able to de-stress and bring you, you know, prioritise what's important in your life. Because we automatically go, oh, I need to do this to solve this. Well, actually, it may not be. It may be that, you know, we look at things and it may be that you actually need some financial advice as well. So our social prescription team will be able to help you with, you know, looking at, are you entitled to benefits? Do you, you know, is there things that you're not claiming that you could be? Whether you're in work or out of work as well.
Right. Because even though people are fully employed, there are still benefits that they're entitled to that they're not aware of.
Absolutely. There's
and
thousands
that's
of people.
Crazy to me. That is like, why is that not more... Well, we know why it's not more advertised, but again, like you say, the stress could not maybe be the job itself. It might be the outside factors that are impacting. And actually, I love this job, but everything else that's going on is making me unhappy here.
That's exactly it. Yeah.
I got it.
So we have a huge team of different people within Total Wellbeing that are able to support that one person, and it is a person-centred approach as well that we all take to make sure that, you know, it could also be giving them techniques of joining our walking group and going out and going for a walk, just getting them that headspace as well, and the physical activities. So it doesn't necessarily mean that you have to go to a gym and join a gym to make sure that you're healthy. It's giving them techniques of, okay, let's join the walking group. Or we also have a gardening club.
Oh, right.
So
Very therapeutic, isn't it?
yeah. So one of the main aims of the gardening club was set up under the understanding of not everybody's ready to go back into employment as well.
Yes, that's the other side, right?
Yeah.
And does that normally affect? I shouldn't say normally, but if you've been on maternity leave, I remember when I finished mine, I thought, I can't leave this child with anyone. I don't trust.
Mm-hmm.
Although I was ready to go back, that trust factor of leaving this precious little piece of cargo with someone made me not want to go back to work.
Yeah, so we have a specialist perinatal group as well,
Wow.
and a perinatal therapist, because Jack, as you know, hormones are all over the place, and we may be, I definitely know as a first-time mum round, I mean, these little bundles of joy do not come with manuals.
No. No. And Miriam Stoppard, is she still alive? If you're still alive and you do get to watch this podcast, your handbook is very fluffy. And it makes it sound like breathe in and breathe out and the baby will just come out. No, Miriam, it doesn't happen like that, I can assure you. And like you say, it doesn't come with a manual.
No.
Everything else in life comes with a manual. Flat pack, how to use your phone, what sorts of reading glasses you need, how to navigate the stairs at St Pancras Station, or the escalators, I should say. And the most important thing on the planet doesn't come with a manual.
Yeah, absolutely. And we also go through the things of doubting ourselves as mothers as well. So, you don't know if you're doing it, and such as you say, oh, such and such does this and such and such, and you think, am I doing that right? Should I be doing that? And you panic then.
Yeah.
So yeah, we do have a really good therapist, Olivia. Shout out to Olivia Clark.
This is what this is all about. So yeah, shout out all the staff.
Yeah, who definitely specialise in that area as well.
Great.
So yeah, we do have specialist areas that we therapists work with.
So how many so you've talked about a walking group, you've talked about therapists, pre and postnatal, I'm assuming, services. What other, because it's quite employment, education. It's a massive, this total wellbeing is literally what it says, isn't it?
Yes. Total.
Right.
Yeah. We look at, again, going back to the person-centred approach.
Yeah.
Every person that walks through our door is going to have a different need, a different set of complex needs that we all can, in one way or form, we can support them. Right. And it may be that they're not actually ready for our service, and it may be that they may need more complex approach. Okay. So then that's when we work with other organisations to ensure that that person has a journey that they will go through. Okay. And get the correct support, because actually we deal with low to moderate mental health needs. Okay. Whereas some people, Jack, do come with a lot more emotional baggage and a lot more complex needs, as I spoke about.
And who do you refer those?
It will be the community mental health team. But again, they have an employment advisory team, and we will do a handover to them. So we will make sure that that person's journey, so that they don't have to repeat it over and over again, which is a lot of the downfalls. You know that yourself, you don't go to the same doctor anymore, and you have to go over and over all of the things that are wrong with you. Yeah. So we try to eliminate that as much as possible by giving handovers to those teams. So we may have done the assessment, we may have, and then we hand it over to them.
So they're aware of, let's say, Graham's needs before he has to go through all that trauma again.
Absolutely.
Right.
Yeah.
That's really
because
good.
It may be an ongoing trigger. Every time he has to repeat that.
It sets maybe anxiety or depression comes back.
Absolutely.
Right. That's really interesting to know. And it's really poignant to know that as well, because working as a support worker as I do, if my service user then goes on to, let's say I'm on holiday or never off sick. So if anyone's watching, I'm never off sick. And watch tomorrow, I'm going to get a cold now, right? Because it's been raining. It's really important that they know what's happened to Graham.
Yeah.
What we just spoke about last week and what's going to happen next week. Because Graham doesn't want to revisit what he spoke about. He should, whoever comes in should be able to say, right, this is where we are, Graham. Well, what did you do to support what we were working on last week?
Yeah, absolutely. And also to ensure that it's wider than just the mental health team.
Right.
My team, the EA advisors, they have specific primary care that they work with.
Right.
So they will be based in surgeries, and they work alongside their social prescription teams as well to ensure that person that we're working with, the doctors are also aware of the situation and what's happening with them.
Because social prescribing has become a big thing now. I worked with the NHS as a health and wellbeing advisor, and we work with social prescription teams. It's great.
Yes.
All these services the doctor hasn't got time to listen to Graham. He's got issues with his housing benefit, or sometimes that's what you go into the doctor just to offload. So it's great now that we've got the social prescribing team that can go in and help with his blue badge.
Absolutely.
Or help with his council tax bill or whatever, rather than not wasting the GP's time. It's just using the GP's time more effectively, because he has so many people to see.
And I don't think that's been rolled out to the patients. It's now starting to be picked up on, but I don't think a lot of patients realise that they do have these teams within surgeries. So, for instance, like you say, you go to the doctor, you offload him, but actually it's not a medical need. No. It's actually a social need that this person has. Yeah,
exactly. Maybe issues with their universal credit or their PIP, and they just think, I don't know who to turn to. Yeah. So it's really important, I think, that the GP. I mean, I don't go to the GP, thank goodness, but I think the advertising boards and the receptions, all of these leaflets and pump. I know there are in some surgeries, but not in all. Yeah. And somebody there to explain, look, if this is your issue, this is the best person to signpost you to.
Absolutely, absolutely. Yes, we work alongside them.
So you work alongside the GP surgeries offering this. Yeah. Great.
And the GPs are aware of the service, so they will actually, they have a patient list for us on specific days that we go in, and we will see those people, because you've got people that are going in, let's go back to, they might be in disciplinary, and the best way out of it, they think, is to get signed off sick. Well, actually, no. The doctor can sign you off sick, but actually what you need to know is your employment rights. Yes. And to understand your employment rights and what your employer should be doing for you. And again, going back to somebody that may have been on long-term sick, so they may be navigating going back into the workplace. Yes. And we can support them to do their access to work. Lots of people don't know that they're entitled to access to work.
No,
so it may be that they have an issue with their back. Right. Well, actually, through access to work, they can actually get a specialised chair that can support them. It may be somebody that struggles with dyslexia and things. They can get specialist software for their computer so that they can type or talk into the computer. And that's working alongside the employer and then the employee.
And are the employers, what's the word I'm looking for to be diplomatically
recipient?
Correct? Yes. Of the service.
Of the service that I offer? Yeah. Yes, they are, yeah. Yeah, and we see sometimes it may be, so for instance, we saw with quite a large company.
Glad you said that, V.
that we were seeing an influx of people coming through.
From the same
employer. And then we were able to narrow it down to the same department. So from that, I was then able to go to the HR team and give them evidence of the users. Didn't disclose any names, but the type of the type of things that were coming through. And basically it was just that one manager had been promoted very quickly but never given them the training. So from that they were able to then take it and use it to his advantage
and the company.
And give him some CPD in areas that he needed to improve on. And since then, touch wood, we haven't really seen anybody coming through as much as what we did. But it was just, we could narrow down that narrative.
So it works.
Absolutely
does work.
Absolutely.
And it is about employers being open-minded.
Yes.
It isn't criticism.
Absolutely not.
It's about making sure that your workforce is a happy workforce and a nice place to go to work.
Yeah.
That's what it's about. And I think sometimes when you go in, you go into employers and you're not saying, oh, this is wrong, we need to fix it. What we're saying is let's work together to make it better.
Absolutely. I can give you one real example. One of the therapists had a lady in for a completely different reason. She didn't have any employment issues at all. And the therapist came to me and said, could you just come into our session? It's just I'm trying to work with this client and she's just fixated and stressed out about something that's happened at work. I went into her and she explained to me that as part of her benefits, she got to have a meal on site if she worked more than 8 hours. So she worked every day and that one main meal was her main meal. The rest of her pay packet went towards her 3 children and their food. The manager come in one day and said, right, from tomorrow you've got to bring your own food. We're no longer doing food for you. And her panic was, oh my God, how am I going to feed myself? That money that I earn goes towards my children. That's my one main meal. Now I've got to find extra food to bring in for myself. So I sat there and I said, do you have, did they contact you to tell you 30 days ago that this benefit was going to change? No. Do you have a handbook? And she had it actually on her phone. She said, yeah. I said, well, it clearly states here that you're entitled to a meal on site for every 8 hours that you work. So I said, if you don't mind, I'm going to call your HR team and find out what's going on. But what I want you to do is concentrate on your session with Sharon and then we will go off. Long story short, it was the manager who was trying to cut food costs. The benefit hadn't been taken away by the organisation and the manager was actually reprimanded. But that was because he made the decision not to feed his staff.
But he was probably getting fed quite well himself.
Absolutely. But that one knock-on effect had a huge impact on that
person's mental health and the stress and anxiety, the worry.
The financial burden.
Disgraceful.
Yeah.
But did you manage to solve?
Absolutely.
Of course
Everybody
you did.
the next day had their food back and they were all entitled to that and the benefit hadn't been taken away at all.
Just one person making a decision.
Yeah.
Wow.
That wasn't even authorised
to do so.
Yeah.
That's great work.
Yeah.
So and the reason that we do these podcasts, people think I like to talk anyway, but they think that's just what it is. It's a chit chat. It's not.
Yeah.
It's about raising awareness, making people aware that services are available, how to access those services, that you don't need referrals often.
No.
And you can self-refer, which I've just learnt today, which is fantastic. So I should just be telling everyone to but it sometimes, because you do respond really quickly, so it's not an issue where you're waiting weeks and weeks and you think, what's going on? So like I said, the purpose of the podcast is to raise awareness and how organisations in the town can work better together.
That's it.
More closely, so that little gap in the middle, there's always a gap.
Yeah.
We want to close it.
Yeah.
Completely. So that Graham, whoever it is, my fictitious person, can feel that from the start of his journey till whenever he gets to the end, he's supported. Yeah. There's going to be no gaps. There's not going to be, oh, well, I can't see you for 12 weeks. Oh, you're going to have to carry on your own. There's always going to be access for individuals. That's what this is the whole purpose of these podcasts.
Absolutely. And we also, on our website, we also have webinars that they can actually sit and watch if they, don't want to actually access the service at this present moment. There's a couple on there for common themes, sleep, for instance.
Yeah, it's a massive issue at the moment. I don't know why no one in Luton's sleeping at the moment, but everyone I speak to isn't sleeping. I don't get it. What's going on in Luton? Are you not sleeping either? No. It's insane, isn't it? Doesn't matter what time you go to bed. And I try to be in bed by 9 now, and then I read till 10, and then get up, go to the gym, and start my day. And the days are just getting longer and longer. But just don't seem to be able that button to switch off.
But I think that's today's living. I think we've all got so much going on that we don't actually have that downtime to go, just breathe.
Yeah.
It's
crazy.
It doesn't matter if you haven't washed up. Just if you need to sit down.
If my husband's watching, it does matter. You know what Colin's like, V, but any excuse for a little sit down and a cup of tea. No, it does matter. You wash up. I'm only joking.
But do you know what I mean, Jack? If you've got so much that's filling your bucket and you just need to breathe, or you just need to go for that walk, don't worry about the washing up being done. It's still going to be there when you get back.
Yeah, absolutely. And I think you touched on a point quite pointedly at the beginning of the podcast when you said, and, because I'm a fitness coach, people think, oh, I just want everyone to join a gym. I don't. I literally don't. There's so many, since I've been doing this podcast, there's so many beautiful open spaces in this town that isn't accessed.
Yeah.
I can't believe it. I can't even remember the name of the road, but it's got like a big Chinese, it's just off, oh God, I'm trying to think, Stocker Park. So you come down, you turn left at the lights, and I can't think of the name of the road, but it's got like a big Chinese building in the middle. It's a park. I've never been there before.
Tennyson Road.
That's it. What a beautiful area. I see people on their skates. I was like, they said because the path is so clear and so few people know that this park is there, that they're able to go on, older people on their roller skates. What a lovely park.
Yeah.
Never knew. The grounds at past Wardown, where people go to get their wedding photos done. It's like a little maze. Lovely. Discovery Centre at Stockwood.
Absolutely.
Beautiful space to walk.
Warden Hills.
Now that's a bit challenging for me. I get to the top and I think, am I going to get down? It's all right going up. It's coming up like, Colin loves that walk. When lockdown happened, that's when we started to find all these beautiful open spaces.
Yeah.
But there's so many more that have been tidied up at Woodlands, like where you used to live. And obviously that is a community all on its own. And I'm now part of the Woodland Trust. Don't know why I've done it. Picking up litter. Why? But it's to help the environment.
Absolutely.
And to make sure that these open spaces stay open, and so that, because we've got lots of, as you know, loads of foxes, hundreds of families. I seem to have adopted a whole family. They sit out there like that at night, and I think, oh, why did I start feeding you? But at least I know they're getting a meal. No, it's so cute. No, there's the mum, the dad, and they've got 2 little kids. It's a whole family. And I thought, oh, they look really, and the kids were crying. I thought they might have been playing because they make that awful noise, don't they? And I thought, oh, they sound hungry. So we started feeding them. Colin's like, here we go, family's back. But at least they're getting a meal.
Exactly. Bless them.
But yeah, so how long have you been with Total Wellbeing?
So I've been there 2 years now.
And did you start in the position that you're in?
I did. It was a new service that was being rolled out by the NHS and DWP. So they work in partnership together.
And are you funded by them? Or?
Yes.
Right.
Yeah. And so it was an initiative to put employment advisory with talking therapists because of this reason. Yes, so it was a newly, and actually the people of Luton have been so receptive of it that we are really thriving in this area, which is great, and it's nice to see. We sometimes have to turn people away because they aren't actually right for our service.
That's right.
But then it benefits the people that do need to access the service. So that started in I joined in June 2023, and we went live in August 2023. lots of the other, so Milton Keynes, Bedford, Central Beds, they took a little while to catch up, but once they got going.
Yeah, so this is spread out throughout the whole country?
Throughout the whole country, yes.
Right.
Yeah, it started.
So if I lived in Milton Keynes, I'd go to Total Wellbeing's there, Bedford, Stevenage, Letchworth, all of those areas.
Yeah, and we refer to those areas as well. So it may be that we meet people who may live in Houghton Regis.
Is that more Central Beds?
That's Central Beds,
Right,
yeah. So we refer them to them. But as long as if they did live in Houghton Regis and had a doctor's in Luton, we could accept them.
Right. Okay. So it all depends on where your GP surgery is based.
Absolutely.
Right.
Yeah.
Okay.
Yeah. But because it's that border, we sometimes find it with Lucy Farm as well. They might
Really?
yeah. So they live in Pointers Road.
Yeah.
But they access the surgery in Lucy. They can use us, but they live in Pointers Road, and their GPs are across the border as well.
In Dunstable.
In Dunstable.
Then they have to go.
Absolutely, yeah.
Oh, okay.
Yeah, so there's like little cut-off areas.
Yeah.
Just to not tread on anybody's toes. But we work quite closely with the teams over there as well. So
okay, so all the teams work closely together.
Yeah, so we will always make sure that the referrals go through to them. I regularly speak with the employment advisory team, Chloe and her team in Central Beds and Bedford Borough as well. So
it's a difficult question now. Have you seen a rise in people accessing your services since the shutdown of the main employer in Luton, the Vauxhall closure?
Not at this present moment. We're starting to see it coming through now because officially a lot of people didn't actually get their redundancy pay or
last Friday.
Last week, yeah. So, but we saw
them all in the pub celebrating. Literally, there was every 4x4. I was going out for lunch with my husband. I was like, why is there so many 4x4s? Why is there brand new? Colin goes, it's the last day of the official closure was Friday, and they all went out and said, because they've all got these new cars, and they have been looked after. I have to, not just because my husband's a director there, but they did look after them exceptionally well.
They looked after their staff, and especially the younger staff members as well.
They'd only been there maybe 2 years.
Yes, yeah. So I know, I personally know a lot of them who have taken the transfer to Ellesmere, but they also got a relocation package with that.
I know.
So
I said to Colin, why did we not move to Liverpool? We'd have got a bigger house. Got away from the kids. No, not really. But no, I wouldn't want to go there.
But yes, so we are starting to see the ripples. We did notice it at the beginning with agency workers, though.
Yes, because they were the first to go.
Yeah, yeah. What we are finding now that there is a stagnation within Luton. There isn't those industries at the moment. I've been trying to speak with the skills team and Sinead. I know that Sinead McNamara is working on projects for Luton Borough Council with bringing in new industry. When that's coming, I don't know.
This is the problem. The moment, what do they do?
We're getting more and more people coming to Luton, but there's no work for them. So it is trying to also broaden people's expectation of actually you may need to travel further outside of Luton to get the employment that you're looking for. It's also looking at the infrastructure around Luton is so good as well.
It's fantastic,
and trying to explain to people, okay, you've got the Thames Link, you've got the EMR that get you in 25 minutes.
I should be going. Anyone on the EMR, I should be travelling on Friday to Leeds. I want my Bradford. I want my journey to be smooth and on time.
Then there's
it's also a bit of fun.
Are you not going from Stevenage?
Well, possibly, but I don't know. But that's the EMR, isn't it? Stevenage?
That's the LNDR.
LNDR, whatever. But yes, I'll be going from Stevenage. So Mick Foster, if you're watching, make sure my train's on time. I shall have lots of baggage because I'm going to visit because it's Joshua's first game of the season with his new club. I'm so excited. That's why I'm not sleeping. But I'm also, as a mum, taking lots of treats.
Well, he's not too far from my daughter who's in York, so he will be fine up there.
Yeah, he's just bought his first home.
They're very friendly people.
I'm looking forward to visiting for the first time. I'm also, and I say this on every podcast, what I'm really looking forward to is leaving my socks by the front door, my wet towel over the banister,
Absolutely, Jack.
the toothpaste all squeezed out and just left on this. I'm going to do all of that.
Don't clean the shower out.
Won't be you know the window scraper
Squidgy.
that you use to take all the water. Won't be using that at all, even though it's right there and he's never used it. He goes, I didn't use the shower. Okay. So I'm looking forward to doing all of that.
And please make sure you just leave the TV on standby.
Yeah.
All of your remote controls
on the floor.
Yeah.
All dirty dishes in the sink. You know, where you've eaten a meal and not actually scraped it out in the bin. So when you actually go to wash it, it's so hard you have to soak it. I'm looking forward to doing all of that. So if you are watching, son, watch out. I shall be coming.
Talking about teenagers, though, we do have a specialist within our team.
All right.
So Miles Edwards Francis, he specialises in 16 to 25-year-olds.
Oh, that's really interesting, because quite a good proportion of our service users are within that range.
Yeah. So Miles specialises in that area. He makes sure that they're informed about education, retraining, anything like that. So, you know, we've spoken about work and employment, but actually these are people that are starting off their journey.
Yeah.
That a lot of them were COVID kids. Right. And unfortunately missed out on the careers advice and guidance that they should have been having. They missed out on the work experience.
Yeah.
They missed out on all of those different things. And it was just like, okay, there we go off and navigate yourself. Hopefully, you know, you've got other adults that tell you how to do that. But those other adults didn't know the specialist areas.
Right.
They didn't know, you know, you may have got somebody that didn't get the grades because they didn't have to take exams, but were marked by the teachers, and they may
the coursework.
They may have expected one result and actually
got something completely different,
and then didn't know how to navigate.
Right.
Okay, because I didn't get my GCSEs, which lots of kids have that pressure of. I need to get my GCSEs. Well, actually, GCSEs are stepping stones.
Yeah.
They're just a stepping stone. And it doesn't matter if you didn't get them at school. You can do your English and maths alongside an apprenticeship. You can do your, you know, there's other ways around it. You don't have to, you might have wanted to be a solicitor, but you don't have to go through the normal routes. There are apprenticeships. There are ways that you can go to college, do a level 2, do a level 3, and then work your way to university.
Right.
So, yeah, Miles is our specialist in that area.
We need Miles on this podcast. Miles, if you're watching.
Absolutely.
I'm coming for you next.
Absolutely.
Because it's really about capturing and encapsulating and motivating those 16 to 20. It's massive. Yeah. Massive age. And we know that because we've been there already.
Have got the anxiety of actually, you know, even just having a conversation with an adult.
Because they're always like this.
And they were...
Right?
Yeah.
I don't get it. I say this at every podcast, and, you know, if I keep going over it, it's because it's really relevant, because I see children so young in the buggy. Mum's on her phone. Their child's got a tablet. And there's no... When they were little, we used to push them around the green, didn't we?
Yeah.
Look at that. What colour's that? How does that work? Oh, can you see the butterfly? But they don't have that conversation because mum's on the phone and the child's on the tablet.
Yeah. But even that peer support, you've got to think about those kids that were in COVID. You know, the 13, 14-year-olds that were kept in for more or less 2 years, really.
Yeah, it was. I loved it. Sorry. I love COVID. The weather was really nice.
But it was also that part of they missed out on that peer support. You know, that going out, spending time on the green, or, you know, going to the park with their friends. Those type of activities that they should have been doing and learning off of each other, they totally missed
out on,
So there's that also communication gap with peers as well.
Yeah.
So it's not just the impact of not being able to talk to an adult, but it's also their peer groups as well. And
this is what Miles can help them.
Yeah, we do building confidence for a better career. Workshop that they can come on. We look at all different aspects of their journey, and then look at their personalities and see, you know, what career because you're more likely to thrive in a career that's built to your personality than going and doing something, you know, in a warehouse and checking, quality checking. If you're creative, you're not going to sit there wanting to just check. So yeah, it's really looking at the person and what do you want to do, where do you want to be, how can we get you there.
And with regard to, I want to touch now on the mental health side, which I see a lot of. We're seeing a lot more of it in the community, just generally.
Yeah.
Just as I'm driving around, I'm not making assumptions, but you can see this person needs support.
Yeah.
This person, why is this person on the road? They don't even look. They just walk out. And lucky that, you know, you're kind of compass mentis.
Yeah.
So I'm seeing it a lot more. Are you seeing it a lot more?
Absolutely. Yeah. Yeah. A lot of. Is it that mental health is now more spoken about, so people try not to hide their mental health?
Yeah.
Or is it that people are becoming more aware of mental health? And they're recognising the symptoms, and but they're not quite able to say to somebody, I think you needed just a little bit of help.
Yeah.
I was trying to explain it to somebody the other day of, you know, if you've got an aching shoulder, you might go and get a massage. Well, why don't you do that for your brain? Why don't you go and get a mental massage? Because, okay, you can talk to your friends and you can talk to your family, but actually getting somebody that's trained to say, okay, that's okay to be feeling that way.
Yes.
That's okay to, there's lots of people that experience this, but here's the tools to help you.
So what should they do if they feel like they do need some sort of support? What's the first thing you'd advise them to do? Because you kind of, maybe like me, I'm kind of very aware of my mental state because of the job that we do. So we do need that downtime. And if I'm shouting at the TV a bit more, it's because that person actually doesn't need to answer back, you know. So what should somebody do if they feel like, I'm not coping, I don't feel quite like myself, I'm experiencing things that don't feel quite right? What would you suggest they do?
There's two things. They can go onto our website and self-refer in if they don't feel that they can go to a doctor. Because also, yes, we've spoken about GPs not having time and not being able to get appointments.
Yes.
But if they explain when they're making that appointment, it may be that there's a PA within the organisation that could also speak to them.
You're right.
Also, pharmacists. We have pharmacists on every street corner. Pop into the pharmacist, speak to the pharmacist. They have, a lot of them have little confidential consulting rooms now.
Yeah.
I knew I got ill once. I couldn't get an appointment at the doctor. So I just went, I really felt ill. And I went into Boots and said, can I have a 15-minute consultation? I feel really poorly. And because a pharmacist has to, you know, it's medically trained themselves.
Yeah.
They were able to phone my GP and tell them.
And that's another new service that the NHS have brought in.
Yeah.
Which is this GP/pharmacy referral. If you can't get an appointment, you can, like you say, go and see your pharm. And they are really knowledgeable.
Yes.
And they're really helpful.
Yeah.
And they seem to have a bit more, the 15 minutes is better than the 8.5 that the GP's got. And they just seem to be able to say, oh, yeah, we can deal with that. You might not be able to do it today, but come and make an appointment. Or they've got that contact with the GP to say, this person's really in a bad way.
Absolutely.
You need to see them.
Absolutely. Yeah.
So that's a really good point, V. So thanks for bringing that up. And anyone that is actually watching the podcast and is struggling, I'm not saying everybody rush to the pharmacy, but if you are really struggling to get an appointment and you're not feeling quite right, then that's possibly the best way to go.
Absolutely, because it may be you just need blood tests.
Yes.
You're off balance, you know.
If you're a woman, you're off balance every other day.
But it may be just little things that are just knocking our systems. So yeah, they would be the 3 ports of call that I say. If you're really feeling ill, obviously there's 111.
Yes.
And
again, another excellent service.
Yeah, and
very thorough.
And then obviously A&E. But just reach out.
Yeah,
Reach out.
that's the most important thing.
That's the most important thing. Don't feel that you have to sit there and suffer in silence.
So the total wellbeing service, is it available? How is Monday to Friday, Saturday? What Sunday?
We're Monday to Saturday. So we're 8 a.m. till 8 p.m.
Wow.
And we on Saturdays it's 8 a.m. till 4 p.m.
8 till 4 on a Saturday.
Yeah.
So Monday to Friday, 8 till 8. Saturday, 8 till 4.
Yeah.
That's really good.
Yeah.
Really, really good.
So yeah, and like I say, there's so many different services within the organisation. It may be that you want to stop smoking, so we have a stop smoking team. Maybe that you want to lose weight, we have a weight loss management team. And we also do that for men's groups as well. So not all men want to go to Weight Watchers and sit there with all women
going, oh, well done, Jenny, you lost 3 pounds. Oh.
Exactly.
I remember it so well. It's just
exactly.
awful.
So we do a men's group as well.
Perfect. We're going to be talking a lot.
Yeah.
We're going to be talking a lot. We're going to be talking to all these different departments, if that's okay with you.
Absolutely.
It's really important that our support workers are aware of the services that you're able to offer to our service users.
Yeah.
Because it'll make our life so much easier. I don't want an easy, that's not what I'm saying. What I'm saying is I want accessibility for our service users so that they feel supported throughout the whole time they're with us.
Yeah. And it may be like we spoke about when you come in about doing a workshop for all of your service users so that they, get the information all at the same
First
time.
hand.
Yeah.
Because I can say something to you and then by the time you've passed it on to Kadreen, you've added a little bit and you think, oh, it's not what she told me. And then by the time it gets to Ishmael, it's a completely different story. Gets back to me and I go, I never said that. No, that's how it works, isn't it? That's the circle of life. But if I hear it directly from V, oh no, V said it happens like this, and that's the end result. So it's really good if our service users can get that information firsthand. Yeah. So I'd like to set those workshops up with you.
Yeah.
Mental health, the whole thing.
Yeah.
We can work together. We could be working together forever, which would be great.
And that's the main aim of it, is to make sure that the end user is the able and fulfilled, that they can go off and feel comfortable with navigating the rest of their life.
Their journey, yeah. That's the whole purpose of what we do.
Yeah.
And it's so funny. You'd be in Sainsbury's and one of you said, Jackie, I've got a job. And I think, you don't see them, because they leave and they move on. And Colin goes, I go, oh, that's Brian, service you. Oh, right. He goes, why are they all men? I said, it's just the way the business works, It's funny. But it's lovely that they come up to you and they share their stories about, okay, so my journey ended here with you, but I'm actually doing really well.
Yes.
I've got a job, I've got a home, I got married, I've got kids now. It's lovely. And to be being part of that is really fulfilling.
Yeah. Especially when somebody's at their lowest.
Yes.
And you feel that you've picked them up, you've given them the tools, they've been able to then climb that ladder again and feel that they can breathe.
Yeah. Because sometimes that's what it is.
Yeah.
It is taking that deep breath and going, okay, I've got this, but it's going to take time. And I think that's really important, that people realise that it isn't a quick fix.
Yeah. And I think society's brought that on a little bit of everything's at demand, isn't it, these days, where, if somebody wants, even a takeaway, I'll just go on my phone.
I was just about to say Uber Eats.
And it's there for them.
Guys. Anything, isn't it? Amazon was my best. There are other providers out there. But during lockdown, I never went to a shop. I never went to a shop for 2 years. I didn't. Colin went and done all the shop. I couldn't. Just the thought of germ couldn't stress me out. I thought, oh my God, Amazon. They do food delivery. They even do chemist delivery. I love them. They're the best service ever. You order it today, and by 10 o'clock, it's on your doorstep. Well, should put it in the porch, but it's on the doorstep.
That's the thing. That's what we're creating, and everybody thinks that actually I should be okay tomorrow. Well, actually, no. This is going to take time.
Yeah,
this is going to take time, and it's going to take a little while to work through things. Yeah, but you're going to get there eventually.
Yeah.
And I think, yeah, the pressures of society today to have something instant or be better tomorrow, it's just not a reality.
No. And it's really important that anyone accessing our service, your service, understands that it's a long, we're here for, some people, it's like learning, isn't it?
Yeah.
Some people learn quicker than others. Some people can move on.
Yeah.
And some people are just that little bit slower. And that's absolutely fine.
Yeah.
As long as the result at the end is the same, it doesn't really matter how long it takes.
Absolutely, Jack.
So that's really important to get across to anyone that's watching the podcast and that might feel that they need to reach out. There are...
And it's putting things into perspective as well for that person.
Exactly. And I think you'll find that people across Luton Town are so giving, so understanding. The services that we offer are exceptional and they are accessible, which is what everyone needs to be aware of.
Yeah. And I don't think they're aware of how much is available in Luton.
There's so much.
Yeah.
Until I started this role, I had no clue that all this stuff was available. And it's just out there.
Yeah.
But it's knowing how to, and that's part of my role within the company now, to make service users and the general public and everyone aware that if you have got an issue with X, Y, or Z, not issue, but what's the word for another word for issue? Can't think of it. But there is a service that will fit you and will help you.
Yeah.
And it's really important that you know how to access it. So hopefully the podcasts, will, you know, with the guests that we've got coming on, we'll be able to access all of the wonderful services that we offer in the town, which will be really good.
That would be good. That'd be fantastic.
It's been lovely to talk to you.
And you, Jackie.
I hope you'll come back.
I'd definitely be back.
We're definitely going to set up the workshops and we'll talk to other members of the team. But for now, thanks ever so much for coming on.
Thank you ever so much.